Governor Baird said Papua New Guinea is classed as a middle-income nation as a result of its low population figures and inflated GDP numbers. This means that by 2027, the Papua New Guinea government will pay for the 70% of medicines previously paid by Global Fund.
Therefore, it is important that we fix our procurement for the supply of medicines for our people.
He said among the many PAC inquiry recommendations, one of them was to replace the people in the medical procurement and supplies brands to avoid some of the problems that were experienced back then. Highlighting this, he questioned the health minister on the system issues surrounding procurement of medical drugs and supplies.
How many of the PAC inquiry recommendations have been actioned so far, including particularly the replacement of the line where I involved long procurement? Has that been done? Can the minister inform this House and our people if tenders were sent out as per the Public Finance Management Act requirements? Or suppose NOGAD, how was procurement done? Was it done via purchase orders? If tenders were properly awarded, why were those contracts not supplied? Can the minister table a list of all of these medical suppliers and their current contract value so that the taxpayers, the hard-working taxpayers of Papua New Guinea, can know who is getting their money and for what purpose? Can the minister also give an undertaking to this House and to the people of this country that in future we will reduce the risk by not awarding more than 50% of all of these contracts to just one company?
Meanwhile, Health Minister Elias Kapavore said the government is aware that the Global Fund will reduce its support of 70%. To meet this gap, Minister Kapavore said they are working with Global Fund and other partners on what they can do as a government. He said they will publish the information on media on what his department has done to implement recommendations by PAC in 2018 and 2019, and also a statement on the processes and lists of companies engaged by the department to supply and procure drugs.
The question that came today, a very, very important question. Maybe I can get a media statement on this one and publish all the companies that are engaged by the department. One of our contracts, all going to give him to date. We want to be very, very transparent as much as possible. We can list all the contractors that have been engaged to supply medical supplies, or how many of them are doing the distribution of medical supplies in the country. We can actually, I will make sure that we have that list on the media.
Jacinta Doctor, National EMTV News.